Right, now we finished with the first part of this lecture. We talked about invasion, mechanistics of the invasion, and metastasis and the roots of metastasis. Now let's continue with the second part of this lecture, and I'm going to talk to you about the effects of tumor, local and systemic. Now, what are the effects do tumors have? The effects of tumor could be local and could be systemic and could be both of them. This depends on the size of the tumor, site, and its behavior, whether benign or malignant. In certain sites, a small tumor can have a very aggressive effects while people can survive for some time with very extensive metastatic spread. So, what are the local effects of neoplasms? Let's start up with the benign tumors. Benign tumors can cause local compression effects, pressure atrophy. So, the tumor can cause pressure on the normal surrounding tissue and cause atrophy of the surrounding tissue. Altered function. So, due to compression, for example, of the tumor, this could result in altered function of the affected organ. In a hollow viscous, can cause partial or complete obstruction. For example, benign tumors in the large intestine or small intestine can result in partial or complete obstruction. Ulceration is one of the complications of benign tumors and even malignant tumors. Space occupying lesion of the brain, which could result in death of the patient due to increase intracranial pressure. Now, what about the malignant tumors? Malignant tumors tend to have a very aggressive behavior, tend to destroy surrounding tissue, cause obstruction, either complete or partial, if happens in, for example, in a hollow viscous like the intestine. Ulceration that could result in, for example, bleeding and subsequent anemia. Infiltration around into nerves, blood vessels, lymphatics. Space occupying lesion, increase intracranial pressure and may cause death of the patient if happens. Right, so here is an example on the invasive and the infiltrative behavior of the malignant cells, where the malignancy here invade and destroy the skin of the breast. This is an example on breast carcinoma, where the malignancy is fungating with irregular border, destroy and infiltrate the surrounding skin. Okay. Okay, this is another example on the local destructive effect of malignant tumor. This is a colorectal cancer. Where the tumor growing through the wall of the bowel, as you can see in the arrow, and cause constriction in the wall and lead to obstruction of the lumen of the colon. So the main presentation would be an intestinal obstruction. Also, you can see in the center of this tumor an ulceration. Effects of malignant tumor. This is gastric cancer here, the folds of the gastric mucosa, and this is the huge tumor which metastasize, which invades, sorry, and by local invasion into the adjacent splenic structure. And here you can see clearly an infection also present in the spleen. Right, now let's start with the systemic effects of the neoplasms. The panel of systemic effects of malignant cells, of malignancies, of tumors, and one of these is the hematological effects of neoplasms. Anemia is one of the important manifestations, systemic manifestations of neoplasms. ليش المalignant اللي عندهم malignancy يصير عندهم anemia? Due to many causes. Could be due to ulceration and loss of blood. هاي ممكن يصير بالبناين وممكن أيضا بالmalignant. يعني تيومر وسواء ulceration مثل اللي شفناه مثلا بالكولوركتال كانسر يصير عندهم blood loss, chronic blood loss فيصير عندهم anemia. ممكن infiltration of the bone marrow by the malignant cells فيصير replacement of the bone marrow cells اللي هي احنا نعرف انه واحدة من البرودكتس مالتها هي ال RBCs فشي يصير هذا يؤدي الى ايضا decrease in the production of the RBCs and subsequent anemia. ممكن ايضا due to therapy of the malignancy ايضا يسوي suppression of the bone marrow constituents with subsequent anemia. ممكن أيضا hemolysis, also either as a result of metastasis or as a result of therapeutics of the cancer. ممكن أيضا واحدة من ال systemic hematological manifestations هو low white C and platelets. Also this is either due to infiltration of the bone marrow by the malignant cells فيصير decrease in the production of the white BCs to the circulation أو decrease بالplatelet production أو due to treatment therapeutics of cancer like أكو certain chemotherapeutics تسوي suppression of the bone marrow production of the normal cells اللي هي الوايت بي سيز والبلاتليتس والار بي سيز. ثرومبوسيس وحدة أيضا من ال systemic hematological complications of neoplasms وأعتقد عندكم وحدة من الكيسز اللي هي الكارسينوما of pancreas in your group discussion talking about the thrombosis. In pancreatic cancer one of the clinical features of pancreatic cancer هو يصير عندهم migratory thrombophlebitis ليش due to tumor or tumor necrosis producing platelet aggregating factors هاي يسوي hypercoagulability state that results in arterial and venous thrombosis. Right, another systemic effect of neoplasms is the endocrine systemic effects, and this could be due to either excessive secretion of hormones or ectopic hormone secretion. Excessive secretion of hormone, this could be by benign and malignant neoplasm due to the proliferation of the cells which are normally producing certain type of hormone. When it's under proliferation will result in excessive amount of hormone production by the proliferating tumor cells, whether benign or malignant tumor. For example, parathyroid hormone, corticosteroids. ectopic hormone secretion لا هنا المalignancy الcarcinoma cells normally the cancer cells become able to secrete hormones that are normally not produced by the cell of origin, like for example ACTH secreted by small cell carcinoma of bronchus. So normally bronchial epithelial cells are not secreting such kind of hormone, but the cancer cells now secreting an ectopic hormone. Okay, in this slide this is another example on endocrine systemic effect of tumor, but here it's a benign tumor which is called adenoma, pituitary adenoma. That result in excessive secretion of growth hormone causing acromegaly. And when this tumor grow larger and larger, result in compression of the surrounding pituitary tissue that results in, for example, pressure on optic nerve. The patient may be presented with visual disturbances, headache, ممكن أيضا البريشر اللي راح يصير على surrounding pituitary tissue ممكن أيضا يسوي لنا أيضا changes بالهرمون production of the pituitary gland. فالgrowth of the benign tumor هنا ينطيني local effects by the growth of the tumor و systemic effect due to excessive secretion of the ectopic growth hormone that result in acromegaly. 98% of acromegaly cases due to pituitary adenoma. Another kind of systemic effects of neoplasms are dermatological manifestations, skin manifestations in form of either increased pigmentation. Many carcinomas are associated with such kind of manifestation. Pruritus in Hodgkin disease due to complication by jaundice, herpes zoster with lymphoma, dermatomyositis with bronchial carcinoma. Now, the neuromuscular systemic effect, this could result in loss of balance, sensory or sensory motor neuropathies, myopathies, and all these are not due to metastasis to brain. They could be due to the pressure effect, involvement of peripheral nerves, and result in neuromuscular manifestations that is not due to metastasis to. Now, systemic effects of neoplasms. The patients with the neoplasm frequently have systemic effects. The most frequently being is cachexia, and development of poor nutrition from the effects of widespread tumor metastasis. Progressive weakness and death could result, often from a secondary infection, such as pneumonia. The tumor cachexia is believed to be mediated by activation of cytokines from tumor cells and also from the inflammatory cells responding to tumor cells, malaise, pyrexia, and other symptoms. In many cases, the causes of these constitutional symptoms is uncertain, but they are most probably due to the effects of secreted cytokines like tumor necrosis factor, interleukin-1. These are secreted by the inflammatory cells present in the area of the tumor within the microenvironment of the tumor and respond to the stimuli from the tumor cells to secrete such types of cytokines that result in such constitutional symptoms. Right. Why do neoplasms kill people? Both benign and malignant neoplasms can cause death. This could be due to local effects. For example, tumor in the brain result in a space-occupying lesion that results in a raised intracranial pressure that could result in death of the patient. Perforation, for example, gastric carcinoma with subsequent perforation of the stomach. Hemorrhage. And this could happen, these local effects could happen with benign and malignant neoplasms. Death could happen due to systemic effects like replacement of essential body organs, for example, bone marrow, and we discussed that in the previous slides, lung tissue, liver parenchyma. So replacement of the malignant cells, replacement of the normal tissue by malignant cells results in a defective function of these organs that may cause death of the patient. And such systemic effects are mostly happen with malignant neoplasms. So we discussed in this lecture the concepts of invasion and metastasis. And we discussed the mechanisms and the mechanistics of the malignant cells to invade and metastasize, and the roots of metastasis. And we discussed local and systemic effects of benign and malignant neoplasms. I hope at the end of this lecture you enjoy this lecture, and good luck for you. Okay, finally, this is coronavirus. I believe this virus has a malignant behavior, and this malignant behavior affects the whole planet. Do you agree with me? I wish you a very good luck, and please stay at home, work hard, and thank you.